Good morning. My name is Abhinav, and I'm joined here with my teammates, Zaryab and Tyler from HealthcareHub Consulting to discuss our implementation plan for optimizing the Canadian healthcare supply chain. The Canadian healthcare supply chain involves an intricate network of key stakeholders that provide funding and support at various levels of the healthcare value chain. On average, Canada spends more than 10% of its GDP on healthcare related expenses, with costs for healthcare supplies and procurement making up a significant portion of healthcare budgets. The COVID-19 pandemic has revealed some serious weaknesses in the Canadian healthcare supply chain. Healthcare Hub Consulting has chosen three key objectives to focus on for the discussion of this implementation plan. First, improving Canada's healthcare supply chain capacity to meet unexpected surges in demand. Second, equipping the healthcare supply chain with better digital infrastructure and data enablement. And third, improving a balance between regional and national priorities to ensure local differences are accounted for while implementing a solution that is standardized across the healthcare system to promote cost efficiency and better buying power. An ideal recommendation needs to be adaptable to future changes in demand, scalable across Canada, feasible to gain government support, provide a cost benefit for the Canadian healthcare system, collaborative between different levels of government and geographic regions, and contribute to Canada's long-term sustainability in addressing internal supply chain demands. Healthcare Hub Consulting recommends that the government implement MedChain, a cloud-based platform for supply chain management that will enhance data tracking and supply chain transparency in the healthcare system. Although the federal government provides the provinces and territories with the funding necessary to support healthcare services through the Canada Health Act, change management looking to implement new technology and data enablement into the healthcare supply chain will require high levels of provincial and local involvement. As such, our recommendation involves a fine balance between national and regional priorities to set our solution MedChain in motion. National structures would provide clear guidelines and steps for implementing MedChain into current state processes, like Canada Health Infoway, will be important in ensuring consistency and coordination in the long run. Using encrypted cloud platform technology, data insights from MedChain can be used to make better decisions at all levels of the value chain. Local level procurement can be improved through better inventory management, vendor performance monitoring, and adjustment to local needs. And MedChain will also have the ability to share information upstream to facilitate knowledge translation during a crisis. A recent study led by Deloitte's healthcare practice emphasized the importance of adopting GS1 global standards across the healthcare supply chain to enable fast, and efficient, and safe distribution of COVID-19 vaccines. MedChain aims to extend GS1 compliant barcode systems to all pharmaceutical products, medical devices, and healthcare equipment. Implementing barcodes with global location numbers and global trade item numbers will result in enhanced traceability of supplies from manufacturer to patient, providing more robust data points to optimize procurement and uncover new cost savings. By leveraging GS1 standards, MedChain acts as a way to centralize the platform and connect Canadian public health organizations to the government, suppliers, and other intermediaries involved in the healthcare supply chain. Key benefits of using MedChain and GS1 standards include local level analysts having the ability to monitor inventory, supply usage, predicted demand, storage capacity, and vendor performance. Suppliers having the means to share information on supply availability, proximity to healthcare organizations, expiry dates, and real-time product locations. And provincial and federal analysts upstream having more knowledge on current state supply needs to best serve their constituents and promote knowledge translation.
MedChain software will emphasize data-driven decision-making and give healthcare providers the tools they need to monitor KPIs using easy-to-follow procedures and intuitive dashboards. Whether it's used by a physician, government official, or supply chain analyst, MedChain's strategic collection and inventory management analytics software will help decision makers at all levels of the Canadian healthcare system. With the information, every organization will be better equipped to share their needs, manage their healthcare supplies, and realize cost savings in the future. MedChain's project timeline has been divided into 4 phases expected to last approximately 4 years. 3 months prior to phase 1, the communication plan will be set in motion. The communication plan will target 3 key stakeholders: the federal government, the provincial and regional health authorities, and the internal MedChain team. Initial communications with the federal government will emphasize the urgency of improving Canada's supply chain capacity. An ongoing relationship will be developed with the Minister of Public Services and Procurement to conduct a current state analysis of Canada's healthcare supply chain to reveal Canada's inefficiencies and present actionable information on MedChain's potential value. Canada Health Infoway will help with the development of national MedChain guidelines. Finally, Deloitte Canada will be consulted with regards to GS1 best practices and healthcare supply chain integration, building on the firm's current work with the National Vaccine Management IT platform. Over 12 months, Phase 1 will focus on software development and GS1 standard integration. A full development team will be hired to carry out the project and retained for maintenance. The agile methodology will be used to prevent the need for lengthy testing periods in the future, and platform hosting will be outsourced to a digital compliance firm to ensure that all protected health information remains secure. Phase 1 will also kick off provincial engagement. Using insights from the current state analysis, the value and ease of use of MedChain will be shared with healthcare representatives from every province and territory. These communications will be mindful of the regional differences in healthcare needs and utilize any feedback provided to further enhance the program. Phase 2 of the implementation plan is estimated to last 6 months. This involves a pilot program which will gauge MedChain's effectiveness for 1 quarter before commencing a nationwide implementation. Toronto Central LHIN is representative of a high-density region with large healthcare demands, while Saskatchewan Health Authority represents a much larger low-density area. Organizations like the Can Health Network, a nationwide innovation piloting network, will provide crucial support in implementing the pilot technologies collaboratively. Each pilot hospital will receive MedChain data analysts and the GS1 barcoding system.
Phase 3 initiates a federal expansion, which is expected to take approximately 24 months. This particular phase will involve coordination with multiple levels of government. Using the results of the pilot program, the value proposition of MedChain should be clear to healthcare leaders, enabling an efficient onboarding process. By creating a comprehensive training program, clear process expectations, and dedicated supports for analysts and users, all participants in the supply chain will be able to draw applicable insights through MedChain. After downloading the software onto PCs and tablets, staff will be trained to work with suppliers to upload GS1 barcode data onto MedChain. An analyst from each healthcare organization will be appointed as a MedChain lead and will work with existing procurement staff to implement the software into existing inventory management procedures. Additionally, MedChain leads will conduct biannual audits of data collection practices and provide feedback to the larger MedChain network. Consistent communication frequencies will be established between MedChain leads, the larger MedChain network, provincial and regional health authorities, and a federal team of MedChain analysts to facilitate equitable, efficient, and transparent distribution of medical supplies. Working collaboratively on behalf of each area will reduce competition for medical supplies between provinces and territories, encouraging a collaborative approach that builds on the existing strengths of the Canadian healthcare supply chain. Phase 4 is the long-term evaluation of the program. The goal of MedChain is to remain useful and constantly adapt to future supply shortages. Data extracted from MedChain will allow for better tracking of key performance indicators. The system's KPIs will include holistic aspects of supply chain success, including contracting, procurement, cost savings, patient safety, and healthcare worker experience. A full list of KPIs can be found in the appendix. On a quarterly basis, KPIs will be compiled for each healthcare institution to produce a balanced scorecard. Scorecards can be used as a management tool to explicitly set goals for organizations and measure progress towards these goals in the long run. The total estimated cost for implementation has been broken down by phase and per hospital. The estimated cost of a nationwide rollout and implementation is approximately $165 million. A cost-benefit analysis has been done, revealing that a marginal percentage savings estimated at 0.1% will create large returns on overall healthcare expenditure. Upon completion, the estimated ROI of MedChain is 35% annually. HealthcareHub Consulting believes that MedChain will evolve the Canadian healthcare supply chain with regards to efficiency, collaboration, and feasibility. We look forward to exploring this technology's wide range of applications in the future, and we thank you for taking the time to consider our proposal.